day, good afternoon, everybody. Welcome to my image evaluation series. I appreciate you guys stopping in and taking the time to watch this and learning about what we need to see on certain x-rays. Today we're actually going to critique a C-spine. C-spines are one of my favorite images that we take. I just think it's fun to take a C-spine. It's one that takes a little bit of practice to perfect, and once you do, it's pretty gratifying. So keep working hard. I actually had a young lady call me yesterday. She had a C-spine come up and she had a couple questions about it, and we were able to talk through it, and she sent me the images when she was done, and man, she did a good job. Good job, you know who you are. So all right, let's get started here. Today we're going to use the same PACEMAN acronym that we've been using. We're going to run through this on each image and make sure we have what we need to make a good C-spine. So we're going to start with the lateral, and we know that we take 3 pictures as protocol. We take a lateral, an AP axial, and an odontoid picture. I always start with the lateral C-spine just for the fact that we do those at 72 inches, and I like to get my 72-inch picture out of the way, and then I'll move it into 40 inches and take the other 2. And whatever's more comfortable to you, it doesn't matter what order you do it in. So here we got a lateral C-spine. Position-wise, we're in pretty good shape. There's a couple things that we need to look for when we're looking at rotation of the C-spine. We want to get, of course, as lateral as we can get, just for diagnostic purposes. So y'all can see this D right here. It looks like a capital D, right? That's actually the anterior arch of C1. Now, if you start seeing that D is a little bit skewed one way or the other, and that just means that you're rotated one way or the other a little bit too much. So always look for that capital D, or the anterior arch of C1. Another way you can look for rotation in a C-spine is you can look at the posterior mandible area. We do have 2 of them, one on each side, right? We want those to be superimposed over each other. So on this one, it looks like we've done a pretty good job. So this is a very nice lateral C-spine. You can tell that it was done on somebody that's a little skinnier. We normally don't get penetration like that through the shoulder. But when you get the skinny winnies, sometimes you get some really cool C-spine pictures. So area-wise, we need to be able to see 7 cervical vertebrae, right? So we got 1, 2, 3, 4, 5, 6, 7. Then we've got T1, and we actually see 2 or T2 and T3 right here. It's pretty nice. So exposure-wise, we've got very nice contrast. We've got sharp difference between bone and soft tissue. The periosteum is lit up really nice. We're able to see joint spaces really well. We're able to see the vertebral bodies and the bony cortical that is in them. Soft tissue wise, it's a really neat picture of the air-filled trachea right here. You can see the epiglottis right there, the little flap that goes up and down and closes your airway when you eat or drink something. It's a pretty neat picture. We got the hyoid bone right there. Really pretty neat picture. So marker, yeah, we got a left hand marker here. We know that this is a left lateral, and marked very nice. It's out of the anatomy like it's supposed to be. You'll note that the top of the x-ray where we're collimated to is right at the EAM, or the ear hole, and that's where you want to concentrate on putting the top of your light. We know that the centering point is actually C4. Sometimes it's easier for me to open my collimator to a 10 by 12 and put the top of my light right at the ear hole. That way you're gonna get C1, and you're going to get probably, well, in this case, down to around T4. So it worked out really nice. It's collimated really nice. We're pretty close to skin margin, anterior and posterior. I would do nothing different on this picture. Pretty nice picture. So let's move on to the AP axial. Okay. Now the AP axial, we need to be able to see 3 or 4 down through 2 or 3, which we do. You'll note that the chin or the mandible is in the way. That's the reason we shoot an odontoid picture, is we can't see that on our AP picture, even though we are angling cephalic about 15 to 30 degrees. Yeah, we can't. We can kind of see the odontoid here, but it's not diagnostic. That's why we have to do the open mouth picture. Okay. But anyway, as far as APs go, we're able to see, so here we know that the dens is attached to C2, so there's C2, here's C3. So we're able to see C3 all the way T1, 2, 3 through T3. Okay, we know that this is a T1 because they're starting to get ribs come off of it, right? And we've also got a transverse process on each side. We're able to see the pedicles. These are these little circles that are staring at you on each side. Those are pedicles. Exposure-wise, we're really good. We're able to see good joint spaces, good bone, good soft tissue. Like I say, this is a little bit lighter up here just because we're going through more dense tissue, right? But it's collimated really nicely to the skin margins. Really good job. You'll note that the top of the image is right here at the ear hole. Here's an ear hole. Here's an ear hole. You can see the mastoid air cells here. It's just a good rule of thumb for a C-spine. Open your view box to 10 by 12. Put the top of the light at the ear hole, and just let the collimation do its thing. You can collimate a little bit tighter side to side, but yeah, this is a good AP. We've got a good marker there. We know that that's the patient's left side. It's out of the anatomy like it's supposed to be. So aesthetically pleasing picture. I would do nothing different on this one. You'll note that the patient's head is a little bit cocked to the left side. Not the end of the world again. Just try and keep the patient as straight as you can whenever you can. So we've got the lateral, which is very aesthetically pleasing as well. It's a nice lateral. We've got the AP. Again, good picture. Let's go on to the odontoid. Okay, odontoids are a fun picture to take. It does take practice, and probably tomorrow or the next day, I'm gonna do a video on proper ways to do the odontoid so that you get it every time. It's gonna be good. Tune in for that one. Anyway, let's look at the position here. So looking at rotation, we look at the lateral masses. These right here are called lateral masses, okay? And we look at the distance between the medial lateral mass and the lateral dens or atlas or axis or odontoid. This is the odontoid right here. Those spaces should be fairly equal. So we are rotated just a hair. Definitely not enough to redo anything because we've got a little more space on the left side versus the right side here. Okay, that's something you need to look for as far as positioning goes. The mouth is wide open. We're able to see the tip of the dens right here, or the odontoid. We're able to see the zygapophyseal joints right here, and we're also able to see the lateral masses. Okay. A very, very nice picture of the odontoid. These joint spaces are just fabulous. So we know that this is C1 and this is C2. So C1, C2 fits up in there, and there's ligaments that attach to the dens to kind of hold your head in place. it's a scary bone to break. If you break that bone, you're in bad shape. But yeah, nice picture. So we're able to see the area we need to do. We're collimated nice and tight. That's the key to a good odontoid, getting good contrast. Is, just bring your box in as tight as you can. I always try to do it to the size of the mouth box right here, from the bottom of the mandible up to the bottom of the nose. Okay, if you can collimate to there, you're gonna be good. You don't want to cut your lateral masses off or anything like that. But this one is collimated perfectly. So, but exposure-wise, we're in great shape. Man, look at the joint spaces there, and the difference between the soft tissue and the bone. We can definitely see bony cortical. If there was something amiss in any of these bones or a disruption in the periosteum, we would be able to see that. So this is a very diagnostic picture. This is the reason we do an open mouth. I know people scoff at it and laugh at it. Patients get a kick out of doing this picture, but it's necessary in order for us to see C1 through, the bottom or the top of C3 right there. It's a very important picture to take. So if you're not taking this one, please do. If somebody has a fracture up in that area, it's something that needs to be dealt with quickly, and the way we figure that out is through this picture. So make sure you're doing the odontoid and practice them and get good at them. Okay, we've got a marker. This marker is in the body cavity, but that's okay because our area of interest is right here. Okay. You'll note the front teeth right here, and we can see the occipital. We don't want those to be obscuring the odontoid at all. And that's what we're going to talk about in the next class that I put out later this week, is how to get this picture every single time, because it is tricky. So, but yeah, very aesthetically pleasing odontoid. Very, very nice. I actually took this picture, I don't know, about a month ago or so. I just love C-spines. I just wanted to show you why we take earrings out for C-spines. This picture was taken, in March sometime. But anyway, they've got these stud earrings. I know some of them you cannot take out and you just have to deal with, but whenever possible, take the earrings out for a C-spine. We also want to take glasses out. We want to remove any artifact that's gonna, we're not able to see the joint space between C1 and C2, okay? It's just not great. You can see the anterior arch of C1 right there, which is pretty good. You can see that this posterior mandible isn't lined up with that posterior mandible, so we've got a little bit of rotation. But the reason I put that picture there is to show you that earrings are in the way when it comes to C-spines. Okay. Now, if by chance you're not able to get C7 T1, you'll need to do a swimmer's. Okay. And this is a swimmer's view, and they're a little bit tricky to get. You have to use a lot more X-ray photons to get through that shoulder girdle on both sides. But this is a fairly decent swimmer's view. There's no marker or anything. I just wanted you guys to see what a swimmer's was. We will talk about that more with the T-spine. With the C-spine, you don't have to take the swimmers if you've got C7 T1 on your lateral. If you don't, you do need to take the swimmers. But when you're shooting a T-spine, you have to shoot a swimmers because you're going to be missing, T1 through T4 usually just because the shoulder's in the way. So these are a good one to practice and get good at. Sometimes it's hard to tell what's what, but we've got these prominences coming off. We know that the prominence that comes off of T12 is bigger than the one that comes off of C7. So I'm thinking this is T12 right here, or T1, and this is C7 right here with a little bit shorter prominence coming off the posterior. So this would be C7. throw the C T1, T2, T3, and so on and so forth. But yeah, swimmers are a good one to know how to do and get proficient at, because you will have to do them. It's always my hope when I do a C-spine that I'm able to see C7 and T1 on my lateral, and I work at it so I can see that. Relaxing the patient's shoulders. You can use weights on the patient's wrist to kind of bring their shoulders down so you can see C7, T1. Anyway, I hope this was helpful, guys. This is exactly what you want to see on a C-spine x-ray. Work at it, practice it, get good at it. It will be rewarding for you. I appreciate you stopping in today. Like I say, I'm going to do another video later this week covering the odontoid. Lots of information out there on the Sterling Hub under the radiology group. And it's also on my YouTube channel, Wyoming X-Ray Guy. If you want to get on there and watch this stuff and improve yourself as far as x-ray goes, I think you should do that. Anyway, thanks for stopping by today. We'll see you soon. I hope to get around and see everybody and help you in any way that I can. That's why I'm here. So give me a call if you need anything, and have a great rest of your week. See ya.